Hi, George here. What we're going to do in this video is talk about different ways of securing your endotracheal tube into your patient. Now, generally, you might have devices like tube holders, such as this one right over here, or maybe one of these types of Velcro strapping type of tube holders, or maybe this variety of tube holder for your endotracheal tube. The point is, there's a lot of different types of tube holders out there on the market, but if you don't have one of these devices, how are you going to secure the endotracheal tube into your patient? One of the things that we do, and we've been doing this for years and years and years, is using probably what you've done in the past as well, and use some tape. So to create a set of tapes to secure the tube in place, how do you do it? This particular video is going to focus on how you can make a set of tapes so that if you don't have a tube holder like that, or any of the other ones I showed you, how would you secure the endotracheal tube into your patient's airway to prevent it from moving and accidentally cause possibly an accidental extubation or maybe a right main stem intubation? So how do we make a set of tapes? So what we're going to do is we're going to focus in on the table back here. I'll zoom in and show you how to do this. Zoom in like that. All right, so I'm going to zoom out a bit. Anyways, a couple of things that you're going to need. Now, when you're in the hospital setting, you may have to wear gloves when you're making tapes, but otherwise, if you don't have to wear gloves when you're making tapes, don't wear them because it's going to make it that much more difficult. But a couple things that you're going to need. You'll need some tape. Now, the tape that we like to use for adults and larger pediatric patients is this 1-inch cloth tape. Another thing that you'll need, some bifolding cutting devices. We refer to these as scissors. That's kind of my attempt at humor. And you'll also require some of these things, tongue depressors, 5 in total. Now, when you're going to start making your tapes, a couple things to remember about safety. These scissors can be quite sharp. Tongue depressors, generally they shouldn't have any kind of, splits in them or any kind of area that you could get a sliver, but be careful with that too. And the other thing is when you're using the tape and stretching the tape out to get the correct length, be careful that you don't get a paper cut or any kind of burn on your thumb, etc. when you're doing that. So when you're making the tapes, one of the first things you need to do is get the length of tape that you need. Now, if you happen to have one of these overbed hospital tables with you, they tend to be the correct length for a perfect length of tape to secure to an adult patient. Because you don't want to have too little tape, because that's going to mean less security of that tube onto your patient. And you don't want to have too long of a set of tapes, because that's going to mean it's going to be more difficult to wrap the tape around the patient's tube. So 5 tongue depressors in length is the correct length for tape, or one of these hospital tables, which this one happens to be exactly 5 tongue depressors. So let's kind of look at how we do this. Take your tongue depressors, lay them out, if you don't have a table like this, on any flat surface that's clean, because you want to make sure this is kept nice and clean when you are using them to secure to your patient. So there we go, 5 tongue depressors in length, same length as a table. Have your scissors handy in case you need them. The next thing you want to do is you want to stretch out the tape for the length that you require. So grab the tape, try to keep the adhesive side away from you so that you don't accidentally stick it on your skin or have the tape double back. Now when you're stretching the tape out, try to be careful that you don't get any kind of burn on your finger by the friction that's caused by stretching out. So stretch it out, adhesive side up, and then take it to your table or your flat surface. Now you can kind of see, hopefully, that this is the correct length. So I've got the adhesive side up. You need to either tear or cut the tape. Now I like to cut the tape like this without scissors. So I'm going to grab the tape and just give it a quick rip, and the tape comes off. If you can't do that, then you'll need the scissors to do that portion right over there. So once you've got the tape cut, you don't need to hold on to the roll. Make sure you've got the adhesive side up like this. Lie it on your flat surface. Now what you want to do at this point in time, once you've got that tape off your skin, let it lie there. Grab one end of the tape and fold it over to make a tab. So So just folding that like so to make a tab. And the tab is roughly about, I don't know, 3 millimeters or so. We'll do the same thing on the other side. Tab like that. All right, so we've got the tape now. It is exactly the length of the table. Now what we need to do is find the central part of the tape. So you can either do that by putting a tongue depressor like this down. I'll put it here so you can see it better. A tongue depressor down where you think it's roughly halfway on the table, but you want to find that middle portion here of the tape. So this kind of looks like it's about balanced out. Grab your roll of tape again. Tear off a section that is about the same length as a tongue depressor. So we'll tear that off. Again, I'll do the little slip. And I'm going to take this piece of tape, and I'm going to put the sticky side down, the adhesive side down, so it matches up with the adhesive side that's up on the piece of tape that's on the table. So we'll go like this, put it down, so it's roughly right in the center here. And once we've done that, we're almost done making our tapes. The next thing you want to do is take your tongue depressor, find where that double-sided piece of tape ends, and place it on the adhesive part here of the tape that is facing up. So one goes here, the other one goes here. Now you don't have to use tongue depressors if you don't have a lot of tongue depressors, but tongue depressors tend to work fairly good. Now what you need to do is you need to take this end piece of tape, let me just move the table a bit, this end piece of tape right over here, and cut it. Just a little bit past the double-sided tab. So just give it a little cut here. In making this cut right over here, what you're doing is you're making it easier for the tape to be ripped for the tape job when you eventually tape it to the patient. You'll repeat the process on this side as well. So grab the little tabby here that you made, make a cut like that. Make sure it's right in the center here because you want to make it even. And then once you've done that, take this part of the tape and fold it back down onto the tongue depressor so that the two adhesive parts don't come into contact with each other. You'll then repeat the process on the other side, like so. And when you've done that, you'll have a set of tapes. Now the center portion right here that is not sticky because it's got the two adhesive parts facing each other and stuck together. This part's going to go around the patient's neck, the back of their neck. These two parts right over here that I'm holding on to, this is going to go towards the endotracheal tube on the patient's face. And with that, that is how we make a set of tapes. And if you do this in this fashion, and you know how to do it, you're going to be able to make yourself a lot of different tapes for the securing of your endotracheal tube. And when it comes time to using the tape, just pull them out, slide them underneath the patient's neck, make sure there's nothing there to impede the movement or anything that could be sharp that could affect you. Make sure you're wearing gloves when you tape the tube to the patient's face. But yeah, that's how you make a set of tapes. Pretty easy. If you have any questions, comments, concerns, please let me know. Otherwise, I hope you have a great day no matter where you are, and send me some more suggestions of videos that you want to see. Take care. George out.